Welcome to It's Your Case, presented by vetct.com. I'm Heather, your radiologist on demand for this week. Today's example is a 15-year-old dog who previously had a TTA surgery for cruciate ligament disease and now has left hind limb lameness. Now, let's start by looking at the ventrodorsal view of this case. One thing that it's important to remember when assessing orthopedic images is not only do we want to assess the osseous features, which is often the most interesting part, but we always want to take time to look at the soft tissues. I'm going to bring your attention to asymmetry of the soft tissue structures in this case. This may have also been noted clinically, although it does depend a little bit on the conformation of the dog and their overall body condition. Once I see asymmetry of soft tissues, another thing to be careful to pay attention to is the opacity. Here you can see that there's an area of reduced opacity in this part of the thigh musculature. This is consistent with the fat opacity, being a little bit more radiolucent than the muscle or soft tissue. I always like to see things on more than one view, so here's the lateral view of that same limb. On the lateral view, if I focus on that thigh area, I can again see an area of reduced opacity consistent with fat. You can actually see the dissection between the soft tissue and the fat opacity here in the cranial thigh. A few other minor findings for this case. There is a TTA that's been performed, and in general, the appearance of this implant construct appears stable. We could also look at the hips in this case, because we know that in dogs, hip dysplasia or hip arthritis could be causes of lameness. For me, although there are some minor degenerative changes of the femoral neck, more pronounced on the left side than the right, the amount of hip arthritis is quite mild in this case, and overall, given the advanced patient age, I would say that the hip coverage, denoted here by the position of the dorsal acetabular margin relative to the femoral head, and the hip congruity, denoted here by the shape of the femoral head relative to the shape of the acetabular cup, so coverage and congruity, are quite adequate in this case, in my opinion. Therefore, I would include that we have a fat-based mass of the left quadricep muscle region, which is concerning for something like an intermuscular lipoma. Other causes of fat mass can include intramuscular lipoma or even infiltrative lipoma. These can be assessed very readily and differentiated with CT. However, on radiographs, there can be some overlap in the appearance of various lipomatous masses. Be sure to read the full report for this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.